It's Wednesday. That means it's Helping Seniors of Brevard Day with Joe Steckler. Joe is off today, still recovering from his knee replacement surgery from a couple of weeks ago, but none other than Kerry Fink is here with us. Hi, Kerry. How are you?
Hello, John Harper. How are you today?
Wonderful, and we've got a great guest with us as well.
We have a great show lined up on today, and yes, so our guest today, let me go ahead and introduce him, and then we're going to talk a little bit about Joe, Car Raffle. But we have a topic that you don't want to miss today because we're going to talk about, we have in the studio with us Barbara McIntyre, longtime friend of helping seniors and really the county's, I would say, supreme expert when it comes to reverse mortgages and how they can be a great financial tool, particularly as you approach or are in your retirement years. Years, not ears. Hello, Barb. How are you today?
Glad to be here.
And then also, this is going to be fun because we also have in here another, I guess I would call it one of the county's great experts on a registered nurse, has just amazing experience, both in medical side, but the psychiatric side. You have really done this all, Traci Graf. I mean, you have worked on so many areas of medicine, and now for several years you've been engaged in home health care through Avid Home Care. Welcome.
Thank you. I'm happy to be here.
So, and what we were going to do is, it's interesting because when you guys were first talking as you came into the studio, we were like, okay, how do these two topics join together? But they're really very intricately connected because if you're going to have home health care as you age, and most of us do have a preference to try to stay home and do it safely and correctly, then we're going to have financial resources to help us be able to do that. And so this is going to be a great thing that we're going to be able to talk about on the radio today. So as we're going to turn a corner and get into that. But John Harper, I just wanted to say, we're inside 4 weeks now before the Helping Seniors Car Raffle. And I was talking to Joe yesterday, who they are, you know how it is when you have a knee replacement or something like that, they really put you through the paces. They make you do the physical therapy, and it's just, it really, Joe is 86, and so it's a lot for
Well, Joe is probably putting them through their paces.
Well, I could certainly imagine, because we talk about this all the time, but Joe is really probably the most resilient figure. Not only is he the best advocate for seniors that this county has probably ever had, but he's also resilient. In fact, when I talked to him yesterday, he's working on articles because he wants people to know what it is all about when you go through knee replacement and all the things related to that. And that's just where Joe comes from, as you know, John.
Yeah, he pretty amazing, and he is a person that we can all look at and admire as far as his tenacity and his ability to keep on going despite all the obstacles that he has had to face. And this knee replacement is one of two that he'll be going through.
That's right. And Barb, you've known Joe a long time, and you know his character and integrity and what he stands for seniors. And it's funny when I talk to him in the middle of physical therapy, he's kind of like, that's not important. We got to talk about the car raffle because we got to make sure that we fund helping seniors correctly. And that's just the kind of person Joe is.
It's absolutely true. His only focus is how he's going to help seniors in this county, how he's going to keep the nonprofit organization going so people have a resource to go to get information that's reliable. And like you said, he's recouping, he's writing articles about the experience because he's always determined to share best practices and what you can do and how you can have whatever event you have to go through work out the best.
Yeah, and Traci,
he's awesome.
You've seen that with Joe.
Oh, yes. Yep, him and I connected right away on those kind of subjects.
Yep. So we're going to come back and we're going to talk about the car raffle in a little bit, but let's go ahead and dive right into this topic because, first of all, I thought it was great, Traci, that when you were this is actually the first time that you've both been involved in helping seniors for a while now, but this is actually the first time you two have had a chance to meet. And Traci, you did an amazing job of explaining to Barb why your organization is special in the landscape that we have here in Brevard County. And I would appreciate if you wouldn't mind sharing that so people know who Avid Home Care is, and then why we're going to have this discussion about why having good help at home is important and how to help pay for it. So, Traci?
Sure. Avid Home Care was started in April of 2017 by two friends of mine. They really did start it after trying to find care for their own mother. They found that many of the services were cookie cutter like 3 and 4 hour minimums. They found that different staff showed up all the time. No one really knew what they were there to do. There were just a sort of a multitude of problems that I had already been well aware of working on the skilled nursing side of home care. So with us being friends and talking about ideas and them basically being bored, retired business ladies, they decided they were going to start a home care agency. And they wanted to set us apart from the rest, which in my eyes was very easy to do. So we do things a little differently. Instead of just a nurse that we employ coming to your house to talk to you about what kind of needs you have, I'm the one that comes. I'm the owner now. My husband and I bought it from them January 1st, 2019. I'm a registered nurse. I have home care experience and other experience as well. So, and like Joe, I really love to share my knowledge and my resources. And I find a lot of times when I meet with clients, they may actually need other resources as well, other services as well. And they're not even aware that those services are available or out there, how to get them. So I can be a resource in that way. So anyway, one of the big differences is that I come out, I'm the one, we talk about what kind of needs they have, and we really set a very customized schedule to only what they need. I take everyone on like a long-term relationship, every client, because we are flexible enough with scheduling to change as their needs change. So if they only need us for a few hours a week in the beginning, but anticipate at some point in their life they may need us every day or all the time, we're certainly going to be able to sort of go and change with what their needs are. So, my husband and I personally hire all of our employees. We have around 40 employees right now.
Wow.
We do serve all over the county. We try very hard to hire people in areas and then connect them to clients in the area roughly, where they live. And, with me being the one who does the hiring and the interviewing and then coming out and seeing the client, I've become somewhat of a matchmaker. And I'm pretty good at it too. But I've gotten better, I'll say. But, I think that's a big part of the success of having home care is that you have a connection with your caregiver. And for me, when you're changing staff a lot and things like that, it's a big piece of it that's missing. Yeah. So we definitely do things differently in the way that, I'm the one that comes, I'm the one that knows the employees. Now I know the client, I see the environment, right. I know who's going to fit well. And, we do a lot of work to make it very custom to them. And it really is very different than the way everyone else does it.
And everything you're saying is right on point. I was thinking if you ever talk to Joe for any length of time, one of the things that he always speaks about is the importance of creating an aging plan. And I know I say this a lot, but when we're kids, they tell us, well, what's your plan for when you grow up? What's your job going to be? What do you want to do?
Right.
And then you get into your working years, and then everybody's like, okay, what's your plan for retirement? Are you sending your kids to school? What do you want to do about this? And they give you all these things. And then when we get to our retirement years, Joe has always said, but that seems to be too often where the planning stops, right?
Yes.
You just kind of say, well, now I'm retired. Maybe I did okay, and I set aside a little nest egg, so I'll be fine. But what Joe is referring to on an aging plan is a lot different than just, here's where my money is or whatever I'm going to do about that. He's really talking about the things that you and Barb are really experts in, which is how do you create a plan that is going to be workable given things that you could run into but may not run into, but you at least need to have them on your screen. And I guess a question maybe to jump off on this discussion is, I hear a lot of times that too often decisions get made, in the boiler room of a crisis.
Right,
Absolutely.
right.
Something has changed. Somebody's now in a hospital. You can't. They can't go back to whatever was normal. And now you guys all too often are reacting to the emergency situation.
Yes.
Whereas wouldn't it be great if somebody thought a couple of steps ahead and kind of already had thought about some contingencies?
You know, Kerry, I think there was a time when just having saved, created your retirement pension or your retirement annuity as you worked was sufficient. But over time, as we are living longer and costs have continued to go up, and we haven't always had our investments perform the way that we thought they would.
Good point.
What's happened is the necessity for really planning and looking at what does my retirement look like has increasingly become so much more important. And I also think that people do realize that more so, which is why the services in this radio broadcast is so critical to introducing people in our community, to having resources to start looking at this not when they're 80, but when they're 60. They may not be retired, but they know they're going to be. And they also know that they're going to live longer and costs are going to go up. So deciding if you think you see yourself moving to an assisted living facility, that's a great decision to make. It will change how you look at using your home. You'll want to preserve equity in your home so that you can sell your home and use those funds to go into assisted living.
Right.
But if aging in place and using the services that are in the county to help you do that is part of your goal, then you may want to look at how can I put things in place to guarantee I will have equity available to me over the next 25 or 30 years that I may be retired and living in my home. And surprisingly, we do have people living 30 years in retirement in their home.
Oh, yeah.
Oh,
Oh, definitely. I've had many patients who have gone 100 and over here in Brevard County since I've been here.
Absolutely.
I was going to ask that question because I had somebody tell me that that once you turn 55, so it used to be, I guess at 50 they send you your AAP card, but sometimes these discounts come in at 55. But I'm being told that if you make 55, you might as well plan for like 95 because, you're going to have 40, 45 years.
Yeah.
And they're telling me, and you probably could really speak to this, is that 100, I remember Joe asking his doctor, am I the oldest patient that you're doing a knee replacement on? And the guy said, no, Joe, it was like 102. You're a whippersnapper. By
I had a patient who broke his femur in a spiral fracture bowling, and he was 99, and he turned 100 on service with us at Health First Home Care. It was absolutely incredible. Wow. And he went back to bowling.
Of course, that's what kept him young.
That's right. So, and that ties in a little bit with, what we're about. I think some people perceive home care as I'm raising the white flag.
Yes.
I'm giving up.
Which is so not true.
I cannot. I've gotten to the point that I can't do anything for myself. And I've just sort of gone on this slope downward for years and haven't done anything to sort of stabilize a little bit.
Mm-hmm.
Yeah.
Instead of connecting with services early enough that you're continuing to help keep your independence.
Right.
Help, even with a couple hours a week is enough to help keep your independence, to take you shopping.
You even said, I know you mentioned that you have one client that you go for
1 hour every other week.
And
I'll tell you why we do that.
I'll
tell you why we do that.
It's so good.
She had a stroke and she is unable to go down the 4 steps in her mobile home to get to the washer and dryer. So she cannot afford a 4-hour minimum. If we didn't exist, she wouldn't have any help.
Right.
So thankfully, one of my friends out there in skilled nursing home care met her and connected her to us. And we go once every other week for 1 hour and do an hour worth of laundry. And that's it.
I was going to say this too, Barb McIntyre, as we're talking about this, you've heard Joe talk too about the fact that if you plan correctly, the ability to age in place is not only is it cost effective, but it can be, it's where most people, I guess the majority, really choose to be. It's home. It's where they're comfortable.
Right.
And you just have to be able to do certain things be willing to get the help that you need at home, maybe make some home modifications so that you can do the things that you need to do safely. I was thinking about your friend you're talking about, with the steps. I mean, clearly you need some resources to be able to shift some things, but if you can just do those things, that's what a reverse mortgage could help do, right?
Some of the things that people use a reverse mortgage for in order to age in place is they may go ahead and take out the existing bath that has a big step up and put in one of those really nice, you just open a door, step in, and you can either bathe or shower. Putting in ramps, rails, anything that assists the homeowner. They're using the equity that they wouldn't normally be able to access any other way. With a reverse, they can access that equity, make these changes to make the house perfect for the rest of their retirement, and they don't have to make a monthly mortgage payment, which helps their budget be able to live still on the fixed income they have. But if they choose to make a payment, they can. So the misconceptions about the use of a reverse mortgage, I think people are starting to realize you are still the homeowner. You make all the decisions, and you are not at risk of losing your home as long as you pay your taxes and insurance.
I think we had the conversation. I remember asking when you and Joe had done a radio show on this topic before. I said, well, so it's kind of like having a home equity line of credit. You're just not obligated to make payments unless you want to.
Exactly. That's exactly what it's like.
And so, I remember too, Joe has done a number of calculations over the years where he sat down and he's like, if you imagine scales, and on the one hand, you put what the cost of assisted living is.
Right.
And usually when people start to add up, they're actually quite shocked at how much assisted living actually costs.
And they have to be careful because a lot of times the amount that's told increases once they move in, and they don't realize it many times where they start getting extra services that they don't think. I've seen people be charged for the person to come in and turn their oxygen on and off.
Wow.
Okay. I mean, somebody comes to check your blood sugar, you're going to be charged. Somebody comes to make sure you took your medication, you're going to be charged. Somebody, and it adds up. Yeah. It adds up.
So and I remember Joe doing a calculation. He was sitting with somebody and he said, so if I had somebody come in, like X number of hours per week, and maybe even over time it grows because I need more help as I get older, it sure seems like that calculation really swayed in favor of staying home.
It does. It
For
usually
some people,
does.
it does, yeah.
And the other thing, too, is some people think about possibly selling a home, and this is a little off topic, but they think, well, maybe I should rent. But when you compare living in the home that you've been in, even with the ongoing cost that being a homeowner has, compared to what you can get today just renting, it's amazing how much more expensive it is to rent.
It would be, that would definitely be
So I think aging in place, and especially given the numbers of retirees moving into this time in their life, I mean, 10,000, 11,000 baby boomers a day are starting to collect their Social Security benefits. And, of course, that number, I believe the millennials behind us, the boomers, are even a bigger number. So this is going to become a really ongoing demand on services.
It's not going to go away.
And so, Traci, your company, that's awesome because that's exactly what we need.
Let me give a quick example of one of the ways that we, as like Joe's talking about weighing the cost. A lot of people don't realize that one of the more popular ways that we tend to help people save cost is we do something called a split shift. So many clients who are elderly tend to nap or be inactive in the middle part of the day.
Sure.
In the morning and the evenings, that's my goal in life, Barbara. That's my goal. Maybe I'll get there someday. But, in the mornings and the evenings are the busiest times. It's the time when people tend to get hurt. Why do they get hurt? Because they're up trying to make a meal, or they're in trying to take a shower, or they're trying to change their sheets, or they're doing, they're trying to walk the dog.
Right.
So we find that many people can live for a long time in their homes with a sort of a schedule that hits them for a few hours in the morning and a few hours in the evening. We go when they're getting up, get them started for their day, cook them breakfast, get them up, showered, dressed, everything. They're out the door. They come back in the evening, and they do the complete reverse. They make them dinner, get them put to bed, do whatever needs to be done, lock up and leave. And as long as they have things like a life alert and they're not up wandering around at night, they don't have severe dementia, that schedule works really, really well for people long term, and it's very cost effective.
Well, and that's what we were talking about, because you're really buying what you need as opposed to something that may have a lot of bells and whistles, but you can safely move along without it. And the thing that I like that you mentioned too is the fact that somebody's basically, let's be honest, they're doing a check-in a couple of times a day to make sure so if anything goes amiss, you're going to be right on top of it.
Right.
I mean, we have found clients on the floor. It happens.
It happens, sure.
And it's kind of, how long have you been here? Well, since last night sometime, I mean, it happens, but I agree that if you can't afford 24/7 care, that daily check-in, even if it's an hour in the morning and an hour in the evening, there are clients that we do that.
Yeah.
5, 6, 7 days a week.
I do think there are a lot of people that want to have services like this, and they own their home or maybe have a small mortgage, but they can't use the brick and mortar. So they think they can't afford to do this.
You're completely correct.
And so that's where knowledge is power.
Yes.
Looking
Definitely.
into what would be involved in possibly tapping into some equity to use these services.
Right.
I just can't urge the community enough to reach out and find out how this would affect them and be a resource, because too many people need these services and think they can't afford it. I feel sure.
Oh, definitely.
Yeah, and everything that you guys are saying, this goes back to Joe's beating the drum about, let's make an aging plan, because this way you can start at a level that's very, very nominal and just get used to it. Even as we've all learned in COVID, we've had to make a lot of adjustments to how we do things. And so people are sitting there ordering stuff online, paying delivery charges, and yet, to be honest, you could have somebody come into your home, help you organize these things, and you're probably not spending a lot more than you're spending now.
Come home, put it all
It's
away,
true.
cook you 3 meals, put it into containers, and stick it in the fridge
And you're ready to go.
for days.
Unbelievable. We're gonna really dig into this topic, and we're gonna be talking some more about the car raffle. And John Harper, the car raffle is coming up in less than 4 weeks, so we're definitely going to be talking a lot about the car raffle. You can get your car raffle tickets at Helping Seniors carraffle.com. Helping Seniors carraffle.com. And John, we've got some great cars, and we're going to be talking about that as we come back from the other side of the break.
Looking forward to that, Kerry, Fink, and you are listening to Helping Seniors of Brevard, heard every Wednesday, 12 noon to 1 o'clock, right here on 90.3 FM. It's Helping Seniors of Brevard with Joe Steckler. Joe is off today, and Kerry, Fink, it seems like that music always gets people dancing. Barbara was just dancing here, and seems like everybody likes that music.
In those days, with the big band music, they called them afternoon tea dances, and I was thinking that's almost where we're at with Glenn Miller and String of Pearls. It's great. It's great. Gotta love it. So yes, John Harper, Kerry Fink, and John Harper, and Barbara McIntyre and Traci Graf. We're all in here for Joe Steckler, who is recovering from that knee operation, and probably they're putting him through the physical therapy paces and all the great fun that all that must be. But it's getting him ready for great fun that we're going to be having with the Helping Seniors Car Raffle. And actually, before we dive back into today's program, which is how home health care can make a difference for you and how to help finance that, is what we're going to be talking about. But let's talk about the car raffle for a minute, because we're inside the 4-week mark. And on October 10th, 2020, somebody's going to pick up keys to a brand new car, and that could be a 2020 Chevrolet Camaro. They can pick which one they want. 2020 Chevrolet Camaro, 2020 Dodge Challenger, 2020 Kia Sportage, or a 2020 Mazda Miata convertible.
Barbara, which one would you pick?
I think I'm going for the Miata.
Really?
Wow, cool. And Tracy?
Tracy,
I
which
need
one?
the SUV. I have to have an SUV.
The
I don't want a
SUV?
car anymore. Yeah.
Kerry?
You know, I remain undecided. I'm going to tell you why in a moment.
Undecided.
Yeah, and I'll tell you why. We are actually going to be out at the American Muscle Car Museum over the next couple of weeks, and we've actually set up a date which we're calling the Dodge versus Chevy Challenge. And we're going to be out. We're going to be out there to film this because if you've been out to the Muscle Car Museum, you know that Mark actually kind of has like a test track that goes around the building.
Right.
And so Jennifer Helen, who has staked out the Dodge Challenger, and Ashley Caswell, who has staked out the Chevrolet Camaro. We're going to put them to the test. They're going to get to drive each of the cars around. Then we're going to make them switch, right? So they're going to have to switch and drive the other car and see if it changes anything. But we have a Just for Fun survey out at helpingseniorscarraffle.com. And, we're in political season. So, you know how they're always talking about the polls within the margin of error and all that kind of stuff?
Right.
Well, that's the way it is. The top two cars, just by a nose, the Chevrolet Camaro is at like 31%, and the Dodge Challenger is like 29%. So it really is a toss-up. But make no mistake, the Mazda Miata is right up there, too. I think it's 27 or 28%. And there are a lot of people who appreciate the practicality and like that Kia Sportage, too.
That little Kia Sportage, that is a practical car, and I think if somebody were to choose that, they wouldn't be disappointed. However, Kerry, I don't think anybody would be disappointed with any of the cars.
No, I'll take any of them.
Yeah, that Dodge, I think, is a hot car.
Yep.
And muscle cars are back, and that Dodge proves that. And also the Camaro. It's a great car as well.
They're all like amazing. We went around to all of AJ Hire's car dealerships over the Labor Day weekend. In fact, you can catch our visit both on the Facebook page, Helping Seniors of Brevard, and you can also catch it on our YouTube channel, Helping Seniors Brevard. And actually, you can see them at helpingseniorscarraffle.com. And we went and we talked to experts in the dealership about each one of the cars, and they're really impressive. And so when you ask me which car, that's what I said. I'm undecided. I would probably end up having to possibly flip a coin or decide because they each have so many. They each have so many unique attributes. If you want to look,
I've driven the Dodge, and that Dodge is absolutely awesome.
oh, they're all fun to drive. And so the question is like, do you want to look really cool going down the street in a muscle car? Or do you want to have
the comfort.
wind blowing through your hair as you're tooling around in the Mazda, on a sunny day with the top down and just enjoying life beachside? Or there's a lot to be said for that Kia Sportage because you can take a lot of stuff around in that. It's comfortable getting in and out of.
Very
so
nice.
each car is like just a great deal by itself. And somebody is going to have to be forced to make that tough decision.
So you win and you pick which car.
Then you win and you pick which car. Now, last year, John, you remember when we were all out at the Muscle Car Museum, the lady was there that night. She picked that 2019 Dodge Challenger and is still roaring around Brevard County in that car. And so I do want to say this because a lot of people have asked this. So because of COVID, we cannot have a crowd out at the Muscle Car Museum this year. So what we're doing on October 10th, we are going to be broadcasting Facebook Live basically the entire day, winding up with Mark Pylock, the owner of the American Muscle Car Museum. He'll call out the winning number. His lovely wife, Tatiana, will be pulling the number, and then he will be reading that out. And so we will have a winner on October 10th. And we're going to have a lot of special guest celebrity visitors. We just can't have a crowd event. We had more than 2,000 people there last year. And so what we're going to do, because the governor's restrictions are, we really can't have groups of over 50, and so we definitely would bust those minimums. And we want to do the right thing. We want to keep seniors safe. But let me do say this. When you get your Helping Seniors Car Raffle ticket, you will be going to the American Muscle Car Museum, because Mark Pylock, the owner of the Muscle Car Museum, he said to Joe, he said, I really want to help you guys with this. He said, I want them to be able to have the museum experience. So he said, what I'm going to do is I'm going to set aside 3 dates as soon as the governor allows the gathering, or they feel like they're at a place where they can do that. He said, I'm going to set up 3 dates, and everybody who has their Helping Seniors Car Raffle ticket is going to be able to come in, be my guest, walk around, enjoy the cars. I'll even supply the pizza and the sodas. So you will get a muscle car museum experience with your ticket. So what we're joking about now is the reality is that's probably going to be early 2021. So we're saying is you buy your 5-pack of tickets for $100, right? So each is one chance in the car raffle. So you win the car, you don't win the car, 5 tickets for $100. Now you've got presents for your friends, right? You say, listen, I'm going to take you to the Muscle Car Museum next year, and you look like a great person to 4 other people, right?
Absolutely. What a great idea.
So how do you get these tickets? Let me tell you how you get these tickets. You can go to helpingseniors.carraffle.com, helpingseniors.carraffle.com. You can call Kim Bernard, our education specialist in the office. She'll be happy to help you get tickets over the phone at get a pencil, and I'll give you the number. It's 321-473-7770. Again, that phone number is 321-473-7770. Or if you want to go check out these cars in person, you can go to any one of the Boniface Hires dealerships, say, I want to see that car and I want to get my tickets, and they will help you get all that organized at Boniface Hires Dodge out in Merritt Island. You can stop by the Boniface Hires Chevrolet store on US 1, the Boniface Hires Mazda place, or the Boniface Hires Kia place right there in Melbourne. So lots of fun coming up with the car raffle for sure.
And it's getting close, too.
It
Ooh.
is. So you got it. So the one thing is you got to be in it to win it. You don't want to be talking about it. You want to be in it. And most importantly, you're supporting the work of Joe Steckler and Helping Seniors. Right, John?
That is correct, Kerry. And for the benefit of the folks in the back room, what's the price on those tickets again?
So 1 ticket is $25, or 5 tickets is a $100 donation. And that reminds me, by the way, we read something. We're not the accountants. We're not your tax advisors, blah, 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 all the legal disclaimers. Hopefully Bill Johnson, elder law attorney, would be proud of us for saying all this the right way. But what we do understand is that there are some changes that they want to encourage people to give to nonprofits during these COVID times. So they are actually going to make it possible that you can deduct your charitable giving this year, even if you're not normally able to do it. Maybe you take a standard deduction, but they've said they're making a provision this year so that what you do to help us in Helping Seniors and other nonprofits will be able to be a tax benefit for you this year.
That's great. Encourage people to do more giving.
So with that, let's jump right back to our topic of the day, if that's all right. But first, actually, we were talking during the break. Traci, you guys hire a lot of people to do care, and you're very strict on making sure you get the right people. But talk a little bit about if somebody may have a background or is interested in helping with that, how they get involved with Avid.
Yeah, we are always hiring. We hire companions, home health aides, and certified nurses aides. I prefer people myself who have a little bit of every kind of experience in home care, meaning that they've done home care, they've done skilled nursing, rehab, or been in the hospital working at some point. So they've had a little bit of everything. You have to have your CPR up to date. Mm-hmm. You must be able to pass a background check and have no criminal history at all. Mm-hmm. And, we pay well. We try very hard to match you up with a client and a schedule or clients that work well for you. I'm very good at working around people's schedules and keeping them working. People going to school. I have employees who are going to school, things like that. We work around it. And we have clients who need all different shifts, different times.
Sure.
So if you're somebody who's available, say, only evenings and weekends, call us. We have lots of work in evenings and weekends.
Okay.
So they can call the office. They can apply on, I actually like people to apply on Facebook.
Okay.
They can go to our Avid Facebook page and apply right on there for a position, and they'll be contacted by one of us about coming in for an interview.
That's good. And so while we're on this topic, if somebody wants to get a hold of Avid, whether it be maybe from that side, or maybe it's somebody that's been hearing us talk about this and said, it is time that we should call and at least get somebody to come in and talk to us about that. What's the best number to reach you guys?
Is 321-392-3400. And we have a website as well. That's www.avidhomecareservices.com.
Good. And so while everybody grabs a pencil, let me have you say that number one more time.
I talk too fast. I know. I'm from Philadelphia. I can't help it. 321-392-3400.
And again, the name of the company is Avid Home Health.
Avid Home Care Services.
Avid Home Care Services. Good.
Right.
So find them on the website. Find them on Facebook.
Yep.
Or give them a call. And while we're just doing this, since you got your pen and paper handy, so everybody, we're talking about reverse mortgages. Our expert here is Barbara McIntyre with Reverse Mortgage Funding. And how do people get in touch with you?
Very easily, they can call 321-259-7880. That's 321-259-7880. Or, of course, they can call Kim at Helping Seniors of Brevard, and she will put you in touch with me.
Absolutely. That number is 321-473-7770. And that gives me another opportunity to plug those Helping Seniors Car Raffle tickets, 321-473-7770. And really, that would be a great help to the work of helping seniors. But let's go back to our topic. Again, Joe has really talked about this aging plan thing. That's where we have been. And we said, maybe a good, effective part of an aging plan is making a plan to stay at home and age in place. And Barb, that's where really it costs nothing, right? To sit down and just say, well, here's my situation. What's possible? And you're under no obligation, but at least you know.
Right, absolutely. And what's interesting about the putting a reverse mortgage in place on the home you plan to continue to live in and age in, the sooner you do it, the earlier you do it, the younger you are when you do it, because you can be as young as 60 or 62. There's a few different products available these days. Even if you don't anticipate the need to have to access any of that equity until much later when you do need home health services, if it's been in place, then what it's doing is actually giving you growing access to more of your equity over all the years that it has been in place, waiting for you to have a need. So my favorite mantra is knowledge is power. Mm-hmm. And like Kerry said, it costs you nothing to speak with me. I've been working with this product for 16 years right here in Brevard County, so I pride myself in being a subject expert. And I love sharing all the benefits and the ups and downs of this mortgage. I make sure that you fully understand and determine if it is something that might suit your long-term plans. Because like Kerry said, the aging plan is critical today. And reverse mortgages are becoming increasingly a bigger part of people's financial plan that they're putting in place for their long-term retirement.
Yeah, and I've heard you and Joe joke a little bit about. I know he'll tease a little bit about Tom Selleck, but well, that may be Hawaii, but we're here in Florida, and you need to call Barb because she's got the drill here in Florida.
I often say, Tom Selleck, he's a wonderful, good-looking man. He's done a lot as well as his predecessor for the large AAG out of California that does so much advertising at great expense. They've done a lot to help move our industry forward, but Tom will not come to your kitchen table. Now, I will, and I actually have a photograph of me hugging a cardboard stand-up, full-size Tom Selleck at a convention, and I will bring that picture, and you can look at that and pretend he came to your kitchen table.
Well, that sounds great. Well, and at the end of the day, what you really want is you want the best financial expertise,
right.
and I think that's what really sets apart what you do, because I've seen you sit down with people where literally even if it didn't result in business for you made sure that they got pointed in the best direction
Absolutely.
for what they're after.
I go out and see folks that already have a reverse mortgage and then help get them to understand what they did with another lender, because perhaps
Wow.
they closed their loan and still don't understand.
Wow.
So I support the seniors in this county, and I will do whatever it takes to, just like everyone else who's involved in this wonderful organization. We just want to be, good advocates and help our senior borrowers and.
Make it happen.
Yeah, make it happen.
Thank you for all you do. And Traci, as we're talking about this, if you get the resources in place and you're making an aging plan, it seems to me like one of the really great advantages about giving you guys a call, because it sounds like you have so much flexibility, the way that you work with people. You really are going to find a way to work with them and meet them wherever they're starting from, and then that relationship, because of your background as a registered nurse and understanding, what the situations are, puts you in a great position to assess what's going on and help them figure out, well, this is maybe what this is going to look like over a period of time.
Yeah, definitely. I think just in my home care nursing experience, you walk in houses, you see different things happening, or, you have a client who, say, for instance, we go and help them get cleaned up twice a day. Well, why aren't we using the shower? You know why we're not using the shower? Because it's a tub shower. And they can't get in it.
Right.
And the bathroom is too small. And they have 2 bathrooms in the house. They're back to back.
Right.
But they're each one is too small for them to really get in there with some help, with a walker, with a person helping them as well. And with a simple modification, they're the only one that lives in the home now. With a simple modification, that whole thing could turn around.
Right.
And as a nurse, I can really sort of dovetail that onto a bunch of different things. Development of wounds, not showering, development of urinary tract infections. People develop multi-drug resistant organisms in their urine now. People have skin breakdown and they don't know it.
Wow.
They can't see where the skin is broken down. And very honestly, if it's broken down in an area where you can have it infected with feces or E. coli, you could end up in the hospital with a very, very serious blood infection. And you're left sitting there like, I don't even know where it came from.
Right.
And the nurses know there's got to be a break in your skin somewhere. And chances are it's where you're sitting all the time and not cleaning properly, because you're never really getting your whole body into a shower. It's something small like that I think as healthy people who are able to do that every day, we really take for granted, the luxury of having a full shower, having a shower that you can actually get into easily, that is not a safety hazard, and you can effectively get cleaned. The difference in your quality of life, one versus the other, is night and day.
And I think a lot of times one of the points that Joe brings out all the time is that most of it is that we don't know that these resources are available to us.
Definitely.
And so if we don't know, sometimes things are a question of money, but more often than not, and one of the reasons why, by the way, I think Kim Bernard, our education specialist, has been able to be so successful at helping so many people is really because a lot of times it is getting somebody connected with the right resource at the right stage
Definitely.
that makes all the difference. And a lot of times it's not nearly as costly as people imagine it might be.
Right. I'll give another quick example. I had a client call us last week that when I went to see her, it was very obvious instantly that she was really not going to be able to afford much services from us. I didn't know if she initially thought that maybe health insurance paid for the services. Either way, I went and talked to her and sat and talked to her. And I realized right away that, what she could really benefit from were hospice services.
Right.
She was not dying, but she has end-stage COPD. She is on oxygen. She could benefit from hospice services in many ways. Support, nursing, home health aide coming to bathe her. And I'm basically handing a client that would wanting to pay me cash to a company that is gonna take better care of her, very frankly, in that situation.
Sure.
And she's not gonna have to pay out of pocket.
Right, doing the right thing.
Because it was the right thing to do.
Right.
And now we've partnered with them so that, we'll help her out in other ways while they're going to cover the ways, because I said to her very honestly, I think you need more services than I can provide you.
Yes.
But without my home care experience, very honestly, and I learn something new every day. I mean, learning
I do too.
this from Barbara today is big for someone like myself.
Absolutely.
Because I encounter many, many, many people who, if we could just make a modification or just do this.
And there's
Huge
remodeling
difference.
companies that specialize strictly in going in and doing this type of remodeling, which are very affordable. And I think we might even have. I'm not sure. We'll have to check, but I believe if we don't have someone that's already involved with seniors.
We do have a handyman company that's connected to Helping Seniors. In fact, that's a great point you bring up. We have HelpingSeniorsDirectory.com, HelpingSeniorsDirectory.com. That is a kind of, a modern day Yellow Pages. It's, first of all, we publish it in the center of Senior Scene, but it's also in the online version. And so it's up to date every month. And in fact, by the way, if you're a business and you do work with seniors, give Kim a call. It's very affordable. It's about $1 a day to be in the directory. And that's really what Joe's point has been, is we want to get all businesses who see, and I think what you've heard today, listener, is you've really heard about the heart of the people that are part of Helping Seniors.
Right.
Yes, we all have businesses and we all have the things that we have to do, but if we're not taking care of seniors the right way, we won't stay around and be in business the way we need to in the long run. So it's really important that we continue to learn all these things that are going to help us on our aging plan. And so I just wanted to kind of ask you guys, if somebody, there's kind of a circle that's being built here, right? Because if somebody gives Barb a call and says, listen, I need help in terms of figuring out, can I use my home to help me do some of the things that I might want to do, whether it be the home modifications or in particular, maybe start the cycle of getting some help. Maybe just, and I love that's what we're talking about, is you can move into all of this as you will. You could put that home line of credit reverse mortgage in place, and you, like you said, you don't have to necessarily touch it until you need it, but it's in place when you need it.
Absolutely.
And just like what you're talking about, Traci, you can call somebody and say, let me just start with getting you to help me with my meal planning, but as things move on, then I already know you, I'm comfortable with you, I can ask for more help as we go along.
Exactly. Once people get comfortable with services, we see many, many times that they increase hours.
And that would make sense, and that would be frugal, because again, you're just buying what you need for the time, but with an eye towards what you may need help with as things go along.
And you're developing the relationship that allows you to trust the information. So if someone were to have a conversation with me and get to know me, and then ultimately ask me to refer someone like Traci, I can do that. And because of my relationship with them, they know they're getting referred to someone that's reliable and has their best interest at heart.
Right.
That's the whole network of Helping Seniors of Brevard that works so successfully.
Yeah, no, absolutely. So we're really down to our last minute. Let's give everybody a moment, grab a piece of paper, and let's give these phone numbers one more time. If you want to reach Barb McIntyre,
dial 321-259-7880. That's 321-259-7880.
And that's for the reverse mortgages. And Traci, for the home help,
is 321-392-3400. 321-392-3400.
And as long as we're spitting out phone numbers, 321-473-7770. And John Harper, that's the number, of course, for the Helping Seniors helpline, both for seniors to call in and get help, but also to get those car raffle tickets and be in it to win it.
That's right. Those car raffle tickets, very popular item here on the Space Coast and throughout the country, for that matter.
That's right. That's right.
And you want to make sure that you have an opportunity to win one of those wonderful cars that will be available. And we're looking forward to a great event, a great fundraiser, and the Muscle Car Museum. I was just looking at some pictures of it. As we mentioned before on the show, if you've not seen the museum, or if you've not been to it, I should say, it is an incredible sight to behold right here in Brevard County by the Melbourne Greyhound Park.
Yeah, we're going to show a lot about that on the Facebook Live and the YouTube Live that happens on October 10th. And again, while we can't have visitors to the museum on that particular day, Mark is going to make it available, so your ticket is going to admit you into the museum as soon as the COVID restrictions relax enough for that. So with that in mind, want to thank you guys for being part of Helping Seniors Radio today, and everybody have a good week ahead.
All right, Kerry, be well to our guest, and we thank you for tuning in to this edition of Helping Seniors of Brevard.